Hi everyone, my name is Mark Fayford. This is my assignment 7 for Theory of Health Behavior, applying the health belief model to qualitative data analysis. Just to recap on what we've learned in this class so far, the health belief model is used to explain change in target populations or individuals' health behaviors and guide health interventions using the 6 main constructs. Qualitative data is very effective in obtaining information on culturally specific information, such as values and opinions and behaviors that are embedded in a target population. Very common ways to collect this information is through the use of focus groups So why apply the health belief model to a qualitative study that's focused on a population's access to health care, for instance? Since we're wanting to understand why the population is not accessing health care the way the quantitative data is signifying, we want to get the community perceptions. We want to get primary ground level data to help support the quantitative findings and strengthen our research study. So at this stage in the presentation, what I'd like to do is use a mock qualitative data study from here on out. Excuse me. What I mean by that is assume that we have already started the study, we've already actually conducted interviews, transcribed the interview recordings, and now we're ready to really analyze the data. The first thing we do is just start basic organization. Let's differentiate between the discussions, maybe organized by the question, by the interviewer's question, and then we can start to see what from the quotes and the material we collected, what is directly related to the study, what may be directed to the study, and maybe what's not directed to concerning the study whatsoever. So we want to basically organize the ideas and the concepts. We want to look for words and phrases that maybe reoccur in our So again, for the purposes of this presentation, we're referring to a mock study focused on access to health care for a certain population. What I've done to help organize my data, my qualitative data, is I've developed a table where I list the interview question, the direct quote, verbatim, exactly what was said in the interview. And then I code, after reading through the quote, I code for my own reference and maybe for the other investigators involved on the study. I code what I think this quote may be referring to or what it may be about. And finally, in my thoughts, just my thoughts and ideas, I suggest I need to revisit this quote and reconsider it. Currently, I have I feel like this quote rather. Well, the last time was in September. I just not gotten my paycheck, so it wasn't worth me driving all the way down just to turn around because I have no money. First, I thought that was a financial issue. Then perhaps I came back to it during my data analysis and said, okay, well maybe this is something to do with expecting to be denied care, because some of the other interviews, some of the other direct quotes I've found in the study, seems to have something to do with expecting to be denied care. So I start coding my as I continued to develop my codes and analyze the data and refer back to my interview questions, and I start to develop themes. What's emerging from the quotes? What kind of words or phrases? How do those words and phrases relate to my perceptions or my codes of the data? And I start to look for a deeper meaning in the quotes. So going back to my example, I've added another section from an interview from another participant who had answered the same question about why they did not make their last doctor's appointment. This interview number 2, the individual stated that I guess I just didn't want them seeing me get off the city bus. Okay, my first go around, I also coded this one as a financial issue, financial related to why they did not make their last doctor's visit. But also in my notes, you see that I'm reminding myself to come back to these. But basically, what I'm trying to demonstrate here is how in going through the data, I start to identify through my codes what the quotes may be referring to, and then get those quotes together so I can kind of read and study them side by side. Just further organization. So at this stage, even though our data is not completely analyzed, we're still in the data analysis stage, we can still begin to fit the health belief model into our analysis. What I'd like to start with is first to review the health belief model constructs, and then focus on one construct at a time. From here on out for the presentation, I'm going to be focusing on perceived barriers, and look at how these constructs fit within the research focus and how the data fits within the constructs. So to start, I've listed my perceived barrier specific to my research focus at the top of the page, and I go back to looking at my organized or more organized qualitative analysis, my qualitative table. And I just happen to come back to the same examples we've been referring to during this presentation to start looking for some sort of perceived barriers. Maybe these fit, maybe they don't. Well, financial, sure, that could be a barrier to someone not keeping their appointment at the health clinic. Expecting to be denied care, that too. Maybe embarrassment or some sort of something embarrassing about their situation may prevent them from. So what I've done here is agreed with, let's say, the other investigators on the study that yes, though the financial, the embarrassment, and the expectations of being denied care are in fact perceived barriers. So I take those quotes and I move them over to a new table, a perceived barriers table, specific health belief model focus from this point on. As you can see, we have eventually come to develop themes. Okay, we felt that quote number 1 definitely falls under a theme, anticipation of being denied access to care. Now this theme emerged not only from quote number 1, but from other mock interviews and data collected that seem to refer to similar situations, and we feel that anticipation of being denied access to care was emerged from our data collection. You notice in direct quote number 2, stigma associated with financial strain. I've developed financial into more of a theme and more of an explanation of what's really going on in quote number 2. And this is based on quote number 2, but also data, also other interviews that may sort of refer to the same theme. If you also notice in the far right column, I keep my thoughts. In this case, for time purposes, these themes are my final product for the qualitative analysis. But I like to keep the thoughts going because who knows, maybe we need to revisit those themes, edit those themes. So once we have finalized and we have agreed upon themes that represent the different parts of the data that we've analyzed, we want to summarize those themes. And if you notice in my first bullet, I start to summarize and work to explain how anticipation of being denied access to care is a barrier. Okay, notice that I have this as a work in progress in quotations after my first sentence, add direct quote here. Well, I'm going to go back to my perceived barriers table and look under that theme and look at all the quotes that I've categorized under anticipation of being denied access to care to see what I can find that may fit perfect in that section of the paragraph. And I may try to find another place to put another quote in that paragraph too, maybe at the very end. In stigma associated with financial strain, I have done that. Maybe in interview 2, I took a quote, and then maybe let's say in interview 15, I took another quote and included that into the paragraph to provide a base to not only my theme, but how it's a barrier to how it's a perceived barrier, and provide a little bit more primary support to my argument. So my next steps, I'm going to continue to categorize, code, and theme data. Continue to study the quotes, see what emerges from the quotes. Maybe it's time to move on from, maybe perceived barriers is complete, so it's time to move into my next construct. One thing I'm going to try not to do is force a theme or quote to fit within a construct. If it doesn't fit, maybe it fits elsewhere. Maybe it fits in cues to action, and I had originally put it in perceived barriers. Well, there's probably a better fit if I'm really questioning whether it really accounts for the perceived barriers definition. That's why I like to have that definition in front of me at all times. And of course, maintain several drafts. Make sure I can refer back if I recall a quote or I'm looking for some additional information that I thought I remembered. I just don't want to delete anything, of course. But and that is it. There are my references. And thank you very much, and I look forward to the discussion. Thanks. Bye.